Senate will come to order. The senator from the Hampshire, Franklin, and Worcester district, Senator Comerford, has filed an amendment, the title which the clerk shall read.
Amendment number 57 by Ms. Comerford, racial disparities in health.
Chair recognizes the senator from the Hampshire, Franklin, and Worcester district, Senator Comerford.
Thank you so much, Mr. President, and through you to the members. Mr. President, I am honored to speak today in support of this amendment. First, please let me say, Mr. President, that I'm tremendously grateful to the Senate President and the Chair of Ways and Means for soliciting the input of the Senate's COVID-19 working group during this supplemental budget process. I'm tremendously grateful to them and to their unbelievably tireless and intrepid teams. Our colleagues on the working group heard from food security advocates, housing advocates, from community health centers, from homelessness advocates, and from everyone about the need for more PPE. So thank you, Mr. Chair, Madam President, for hearing these needs and responding with this targeted and necessary investment. I rise today, Mr. President, in support of Amendment number 57. As the Commonwealth invests in helping our people recover and rebuild from COVID-19, we must recognize that the systemic issues that have created the brutal disparities in public health outcomes laid bare by COVID-19 have existed for far, far too long, as my colleagues know. This bill rightly allocates $20 million for, quote, statewide efforts to address racial disparities in healthcare during the 2019 novel coronavirus pandemic, end quote. Including this item in the bill makes an important statement, and even more important, Mr. President, is the impact that these funds will have. COVID-19 has brought into a bright and blinding spotlight the racial disparities in health outcomes that have existed for generations. We must not look away now, and the Senate is demonstrating that commitment through this line item. We cannot look away from the fact that Black people represent 7.2% of the Commonwealth's population, but 14.4% of COVID cases. Latinx people represent 12.2% of the Massachusetts population, but 29.3% of COVID cases. The data are even starker for our COVID-19 death rates. The age-adjusted death rate for white non-Hispanics is 75.3 deaths per 100,000. But for Hispanics, it's much higher at 132.8 deaths per 100,000. And it's the highest for Black residents at 161.4 deaths per 100,000 people. This amendment simply replaces the word healthcare with just one word, health, so that the funds can be used to promote more equity in health more broadly, not just health care, but health. What's the difference? On Monday of this week, at the Senate reopening listening session on healthcare and public health, Dr. Frank Robinson, the Vice President of Community Relations and Public Health at Bay State, and a new appointee by the Senate President to the Equity Task Force, described it this way, Mr. President, quote, healthcare is what happens inside your skin, and health is everything that happens on the outside of it, end quote. Research has demonstrated that 20% of a person's health is related to the medical care they receive, what happens on the inside. Maybe another 20% through research we understand is related to genetics, but the vast majority, put it approximately 60%, is based on what happens outside your skin, what happens in our community. Yet we spend much, much more on medical procedures than on the social conditions that are critical to our health. This amendment will put focus on the underlying causes of vast inequities, the social determinants of our health. By ensuring that these funds can be used to address racial disparities in health and health outcomes, we recognize that we must look at the broad social systems that underlie the lack of true health justice. We recognize, as Dr. Robinson has urged us, that racism is a public health crisis. And Mr. President, I just also wanted to offer my sincere gratitude to the Senate President and the Chair of Ways and Means and speak briefly to my unbridled support for the inclusion of language that would make the 19th of June or Juneteenth a state holiday. To my colleagues, the gentle and fierce lady from Boston and the gentleman from Lynn who led this, thank you. I am glad to join you. To House colleagues who saw this through, especially Representatives Williams and Dom, my comrades from Western Massachusetts, thank you. And to those who are marching in the streets and crying out for long, long overdue racial justice, thank you. Thank you so much for holding us all accountable. The Senate President has been clear that the Senate's approach to racial equity must be comprehensive and has appointed a task force which is working hard to make recommendations for that agenda. But I had a constituent, Mr. President, Dr. Amilcar Shabazz, who has dedicated his life to social and racial justice. And Dr. Shabazz couldn't wait any longer for the recognition that Juneteenth deserves, could not wait for the people of the Commonwealth to come together in a day dedicated to celebrating equity, freedom, and justice. And Dr. Shabazz called Representative Mindy Dom and Representative Bud Williams and I to act now on behalf of Western Massachusetts. In Dr. Shabazz's honor, I am hopeful that next year at this time, June 19th or Juneteenth, will be a recognized holiday in the state of Massachusetts. I'm so pleased that we will take historic action today, that this Senate will take this action to recognize a day when the promise of and the right of freedom was realized by all. Thank you so much, Mr. President.
The question comes on adoption of the amendment. All those in favor say aye. Opposed, no. The ayes have it. The amendment is adopted. The senator from the 2nd Suffolk District, Senator Chang Diaz, has filed an amendment, the title which the clerk shall read.
Amendment number 67 by Ms. Chang Diaz, summer jobs.